Hello, my name is Selena Agamasi, and I'm a doctoral prepared student at Bradman University. Today I'm going to talk about my stakeholder educational plan for my clinical scholarly project. My clinical scholarly project, which is the CSP, will be guided by an evidence-based PICO question in adults ages 18 years old and up in a primary care setting. Does screening with the PHQ-9 forms compared to current practice results in an increase in treatment and referrals over a period of 8 weeks? The purpose of my project is to describe the stakeholders to be involved in their role, identify educational needs for each group, discuss the conceptual framework and theoretical foundation and educational intervention, and my implementation plan. Depression affects over 300 people globally, with the prevalence of the condition increasing by about 18% from 2005 to 2015. That's according to the World Health Organization 2017. The condition also contributes to about 800,000 deaths, and that's a result of suicide every year. Suicide is the second leading cause of death among persons between the ages of 15 to 29 years old. That's also according to World Health Organization 2017. Thus, there is a need for the use of PHQ-9 forms to effectively screen and diagnose depression to enhance treatment. The stakeholders to be involved in my project include a mobile app developer and a primary care provider, which is the PCP. The main role of a mobile app developer is to involve offering technical support to the users of the MoveTool app. The main roles of the PCP is to include overseeing the health of persons, performing checkups, and teaching disease prevention and health promotion. The PCPs will be helpful in my project to perform screening for depression using the PHQ-9 forms. My project is guided by the Bandura's social cognitive theory of depression, which indicates that individuals are influenced by the interactions between their thoughts, behaviors, and environment. Bandura indicates that the self-concepts of an individual with depression are different from a person without depression. People with depression often hold themselves responsible for misfortunes in their lives. The theory applies to my project because it helps to explain the influences of thoughts, behaviors, and outcome and environment for one who develops depression. Okay, thus the understanding of the theory to the patients and healthcare practitioners can help to develop an appropriate plan and intervention for persons with depression. My educational intervention. The educational intervention for managing depression involves the use of the PHQ-9 forms to screen people with the condition to improve treatment and referrals in a primary care setting. The intervention is expected to be successful in managing depression and enhancing treatment because it involves monitoring the severity of the condition based on the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5 or 4. By monitoring the severity of the depression through screening, the healthcare practitioners can decide the appropriate intervention required for specific patients. The stakeholders involved in my project shall be informed about the importance of using the PHQ-9 forms to screen persons with depression. I will educate the clinic manager and the PCPs about the importance of screening patients with depression to monitor the severity of the condition to improve treatment approaches. The stakeholders will be informed about the progress of the project by organizing regular meetings. The PCPs will be trained on how to use the PHQ-9 forms to successfully screen persons with depression and monitor the severity of the condition. The stakeholders will also be encouraged to provide their opinions to improve the effectiveness of the project in managing depression. My implementation plan. The main focus of the implementation plan is to improve treatment and referrals for persons with depression. During the implementation plan um, of the project, an advertisement will be placed on social media, such as Facebook or YouTube, to inform persons with depression about the screening process. The PCPs will be trained on how to use the PHQ-9 forms, which are accessible through the Move Tool app. After the training, the PCPs will use the PHQ-9 forms to screen persons in the first 2 days of the project, where the individuals who will score about 5 to a 9 will meet the inclusion criteria. The stakeholders will be involved throughout the project, where they will offer evidence-based knowledge to patients about the management of depression. The mobile app developer will play an important role in my project of supervising nurses when performing screening and offer technical knowledge required to use for the mobile app. The PCPs will help to educate patients about the importance of screening to enhance the treatment of depression. The PCPs will assess the medical records in the first week of the project plan to identify the level of treatment and frequency referrals for patients with depression. The PCPs will then screen for a patient with depression on a weekly basis and record the level of severity. At the end of the project in week 8, the PCPs will assess the medical records to identify the level of treatment and frequency of referrals for patients with depression. The nurses will now compare the results at week 8 with those at the beginning of the project to identify whether the project results into increase in treatment and referrals. That's the end of my video for my stakeholder education plan for my clinical scholarly project. Thank you.